Greetings. My name is Cheryl Wissa, and I'm the National Diabetes Initiative Chair for the Student National Pharmaceutical Association, also known as SNAPA. And I would like to welcome you to Part 5 and the final part of the Life is Sweet, Savor It, Patient-Centered Mini Lecture Series. This mini lecture will cover new diabetes medication options. A few words about SNAPA. SNAPA is an educational service organization of pharmacy students whose purpose is to plan, organize, coordinate, and execute programs geared toward the improvement of the health, educational, and social environment of the community. We are dedicated to the pharmacy profession and serving the underserved. Now a few words about our guest speaker. Dr. Lori Armistead is currently a postgraduate Year 1 ambulatory care resident at the University of North Carolina Medical Center and Clinics. She received her PharmD from the University of North Carolina Eshelman School of Pharmacy in 2015 and a master's degree in chemistry from UNC in 1998. Her career interests include providing ambulatory care pharmacy services to underserved populations, specifically in internal medicine and primary care. Without further ado, Dr. Lori Armistead.
Well, welcome back. As stated previously, my name is Lori Armistead, and I am currently a pharmacy resident in ambulatory care at the University of North Carolina Medical Center and Clinics. In Part 2 of this particular series, we will be exploring some of the many flavors of new diabetes medications that have been developed over the last 20 years. Now, here's a smattering of some of the newer medications out there. Perhaps you recognize some of their names, or some of them. Perhaps sitagliptin or Victoza rings a bell, or Januvia or pioglitazone. Invokana, Toujeo, and Farxiga are some of the newest medications, having been FDA approved in the last few years. We're going to explore all these medications and more over the next little while. Now, a class of medications that made their arrival on the scene a few years after metformin, but within the past 20 years, are the Thiazolidinediones, or TZDs, pioglitazone and rosiglitazone. Pioglitazone goes by the brand name Actos and rosiglitazone by Avandia. They are dosed as indicated. They were first approved for use in the U.S. in the late 1990s. They increase the storage and use of glucose and decrease insulin resistance. Because they work in slightly different ways than metformin and sulfonylureas, they can be taken in conjunction with either type of medication in order to improve overall blood glucose control. Now, TZDs don't cause hypoglycemia or low blood sugar like insulin and sulfonylureas do, and they produce an effect that is durable, unlike the sulfonylureas we previously discussed. Some studies even show that TZDs may improve cholesterol levels, an added benefit. Unfortunately, TZDs have quite a few negatives. Like insulin and sulfonylureas, they can cause weight gain. They can also cause edema or water retention and swelling, and therefore can worsen heart failure. TZDs can also weaken bones, increasing the risk of developing osteoporosis, and may cause gas and diarrhea with use. TZDs are also more expensive than metformin and sulfonylureas. And because of these negatives, TZDs aren't currently used as much as they used to be, especially since there are newer, better medications out there. DPP-4 inhibitors are another class of medication that showed up about 10 years ago in the early 2000s. Sitagliptin, saxagliptin, linagliptin, and alogliptin are often known by their brand names of Januvia, Onglyza, Tradjenta, and Nesina. They are oral medications and are typically dosed as listed here. Now, sitagliptin was the first DPP-4 inhibitor to be approved by the FDA, being approved in 2006. Alogliptin, the most recently approved DPP-4 inhibitor, was approved by the FDA in 2013. Now, all DPP-4 inhibitors decrease glucose absorption and increase insulin production. They are often taken with metformin to maximize benefit because they work a little bit differently. DPP-4 inhibitors are pretty effective, but not as effective as some of the other medications we've discussed. On the positive side, they don't contribute to weight gain and have few side effects, so they're pretty well tolerated. They're also pretty inexpensive. They do, however, carry a risk of causing hypoglycemia, particularly if taken with sulfonylureas or insulin, and they may cause pancreatitis, inflammation of the pancreas, or in rare instances, edema. GLP-1 agonists are another new class of medications, but they are injectables, not oral medications. Exenatide comes in two forms, the twice-daily Byetta and the once-weekly Bydureon. Liraglutide goes by the brand name Victoza, albiglutide goes by Tanzium, and dulaglutide goes by Trulicity. Victoza is injected once daily, while Tanzium and Trulicity are injected once weekly, just like Bydureon. The once-weekly formulations are more convenient, but they do have larger needles, which causes an issue for some people. Byetta was the first GLP-1 agonist to be approved in the U.S. and was done so in 2006. The two most recent GLP-1 agonists have been approved in the last 2 years. And all GLP agonists decrease glucose absorption and increase insulin production, just like DPP-4 inhibitors. GLP-1 agonists are quite effective, more so than DPP-4 inhibitors. They also don't cause hypoglycemia, a very attractive benefit of GLP-1 agonists. Additionally, they also can promote weight loss, and they also may provide some cardiovascular or heart benefits. And the weight loss is one of the most attractive benefits of the agonists that causes a lot of people to want to try them, even though they are injectables. Amongst the downsides of GLP-1s, in addition to being injectable, is that they may cause nausea and vomiting. There is also a small risk that they may cause pancreatitis or thyroid cancer, but the risk for those is very small. GLP-1 agonists also tend to be quite expensive, but many insurance companies will cover them. Another use of the GLP-1 agonist liraglutide is as a weight loss agent under the brand name Saxenda. It is important to note that liraglutide must be given at higher doses in order to be used primarily as a weight loss agent. Victoza, for blood glucose control, is given at 1.2 to 1.8 milligrams. Saxenda, used for weight loss, is given at 3 milligrams. Both Victoza and Saxenda contain liraglutide, and both are injectables, typically administered in the abdomen, thigh, or upper arm. SGLT-2 inhibitors are the newest oral diabetes agents to be developed. Canagliflozin, dapagliflozin, and empagliflozin are currently in use, but there are other SGLT-2 inhibitors currently being developed. In Vilcana, as you might know, canagliflozin is dosed at 100 to 300 milligrams once daily. Farxiga is dosed at 5 to 10 milligrams once daily, and Jardiance is dosed at 10 or 25 milligrams daily. The first agent in Vilcana was approved in 2013, with the others close behind. SGLT-2 inhibitors are quite unique in that they work on the kidneys, helping the body get rid of extra glucose through the urine. Because of the risk of low blood pressure and dehydration with these agents, however, it is important to drink plenty of fluids while taking them. SGLT2s are pretty effective agents with minimal risk of causing low blood glucose. They also may promote some weight loss and may even lower blood pressure, which could be beneficial if you currently have hypertension. However, caution must be used because these agents may also cause low blood pressure or dehydration, as I previously mentioned. The largest concern with these agents, however, is their propensity to cause frequent urination as well as more urinary tract infections. They are also quite expensive. There are also some new insulin products that have been developed, which adds to the insulin options that are currently available. Afrezza is an ultra-rapid inhaled insulin that works immediately, but lasts less than an hour. There are also some new highly concentrated insulins. Humulin U500 contains regular insulin, but at a concentration that is 5 times greater than standard humulin. Because it is more concentrated, it lasts longer and can be considered more of an intermediate-acting insulin like NPH. Toujeo, a concentrated form of glargine, is 3 times more concentrated than Lantus. It is useful for those who require high doses of glargine in order to control their blood sugars. These higher concentrated insulins are much more dangerous than standard dose insulins, however, and must be used with extreme caution. It is also worth mentioning that there are some other new insulin products that are currently in use, and even more coming out. All of them are similar to the ones listed here. I just wanted to list a few here to give you a few examples of some of the new products that are currently out. And finally, a few other diabetes medications worth mentioning are colesevelam, also known as Welchol when used for diabetes. Colesevelam is a bile acid sequestrant, which means it binds bile acid in your gut. It is also used as a cholesterol-lowering medication, but under a different brand name. Miglatol and Archipose are agents that block glucose absorption in the gut. Accordingly, they may cause abdominal discomfort, diarrhea, and flatulence. Finally, pramlintide is an injectable medication that is given with mealtime insulin to improve glucose control. It may also promote weight loss. In summary, there are many, many flavors of diabetes medications, both old and new. And there are new ones coming out all the time. The best options for you will depend on whether you have type 1 or type 2 diabetes, the amount of glucose control you need, what side effects you can tolerate, if you are willing to use injectable medications or not, what type of prescription insurance coverage you have, and what has worked for you in the past or failed for you in the past. Diabetes is a chronic condition that may require medication changes along the way for optimum control. The good thing is that there are many options out there for you and your diabetes care provider to explore.
Thank you, Dr. Armistead. I just want to give a very special thanks to Walmart and Sam's Club and SNAFA, by whom this web lecture was sponsored. Thank you again, Dr. Armistead, for taking the time to discuss the pros and cons of new diabetes medications that are currently available on the market. Thank you to all the listeners of this web lecture. We do hope that this has been informative and will be helpful in your everyday life and in managing your diabetes. This concludes the Patient Center web lecture mini-series.